Hi, my name is Jen, and welcome to another episode of my autoimmune path. So, for this episode, I wanted to discuss dry eye. Dry eye is something that definitely can come along with having an autoimmune condition. It can just be a symptom of your disease, or unfortunately, it can come along with, as a side effect, I guess I could say, from taking some of the medications that sometimes are prescribed for autoimmune. In my case, I've had dry eye not as long as I've had this disease, but probably about 25 years. So it developed about 5 years in. And I really don't know why I have dry eye. I've mentioned that I had taken a really strong acne medicine, which I was on right before I was diagnosed. And it was, really, it seemed to really be bothering my gut, and the GI doctor who diagnosed me had told me when he first met me and had asked, what medicines are you currently taking? He said, do not take another pill of that. And I had not finished my course. I think I had about 3 weeks left. But one of the side effects of that medicine can be dry eyes. And a lot of times it will just affect a person while they're on the course of the medicine. But a rare side effect can be that it can dry your eyes out permanently. And that, seemed to correlate with me, because it really wasn't too many years later that my eyes had gotten to the point where I could not wear contacts anymore. And I was having to begin using, the drops, re-wetting drops. And so it's been part of my life for a long time. I know a lot of little tips and tricks about it. I'm not saying I'm an expert, but when you live with something that long, you kind of are. But I will say that it was fairly tolerable until the past maybe 2 or 3 years, and then things began to really shift. And I think personally it had to do with me turning 50. And you say, oh well, that's just a number. It is. But unfortunately, as far as just menopause and hormones and all the things, there seemed to be kind of I feel like I had been kind of in a downward slope with all of that, for years. And I was early menopause. But then when I hit 50, it was just kind of fell off the cliff, Things were just really, really different. My eyes have just given me so much trouble, especially the past year. I've had some times when they got really just inflamed with things like uveitis or episcleritis, which basically is just terms for inflammation in the different layers of your eyes, and just kind of depends on which layer. Now, some of that can happen just because of the dryness. They can get so dry that they just get so irritated and kind of red and raw. Unfortunately, I've had to do several rounds of steroid drops this past year, and then recently I had we think we had a virus. It's like that adenovirus or adenovirus. I'm not sure exactly how to say it. My husband and I both had a touch of it. It can cause some GI symptoms. Sometimes it can cause you to have symptoms sort of like a cold. And for me, it gave me kind of like a viral pink eye. So not the bacterial kind of pink eye where, you know, your eyes crust shut. They were just very red and raw. And then, I mean, this is a little gross, I guess, but my left eye had some kind of clear mucus in it one day. And anyway, it was just not fun. And so in the midst of all of that, I ended up going to see our optometrist, and I also went in to see my ophthalmologist. Anyway, you know, it was a lot with drops and all this treatment and everything. And so anyway, but when I saw my ophthalmologist, we discussed my dry eye pretty in depth, and he had actually prescribed me a number of months ago. It was back towards the end of 2024. He had prescribed me some drops that are supposed to help with dry eye, and it was kind of like the generic form of Restasis, and I don't think my insurance company was going to pay for the brand name one. So I had actually picked it up from the pharmacy. The copay was crazy high. It was about $70, I think, for like a month's, you know, supply. And after I picked them up from the pharmacy, I mean, I'm just a researcher. That's who I am. And so I wasn't going to start putting that stuff in my eyes until, you know, I had really thoroughly researched it. What I found out, and look, you have to do your own research, okay? This is not medical advice. This is just my story here. What I was able to glean from the research was that particular type of drop could take sometimes up to like 6 months before you might have any benefit with it. And it seemed that generic version wasn't perhaps as potent or effective as the brand name. I mean, I know a lot of generics, you know, there's hardly any difference, but that was what I got from the research. Plus, I'll be honest, the medicine, it's like cyclosporine, which to me, that sounds like an antibiotic, but it's not. It's, I think, kind of more like a chemo type medicine. Anyway, that's just not really my speed. And if it has worked for you, fantastic, and I'm so glad. But it just, I don't know. I'm always really hesitant about putting chemicals in my body or on my body. So I didn't ever start the drops. Even though I hated it, that I was having to deal with all that, you know, adenovirus mess, it was probably a really good thing that I went in at that time and saw my ophthalmologist. And so he said, well, look, I get it. I get your hesitancy, you know, and I really asked him, you know, just in a respectful way. I said, look, tell me kind of the success rate among your patients, and does this really help a lot of people, you know? And he said, it's kind of 50-50. You know, it just really depends. But he said, we've got to do something for your dry eyes. And I said, absolutely, totally agree. And so he said, well, have you ever heard of serum eye drops? And I said, yeah, I actually have. So what these are, they're called Autologous Serum Eye Drops. And they are actually made from your blood, or they can be made from like donor blood if for some reason maybe you couldn't give blood. But more times than not, they're made from the own patient's blood. And I know it sounds a little weird. Just hang with me. I had just figured, oh, there's probably not anywhere around here that would make them. And he said, actually, there is a pharmacy in the area that does. He said, would you want to try those? And I said, absolutely. He said, okay, well, here's the drill. I will send in the prescription for you. I'll fax it over, and then you'll get a call from the pharmacy. They will schedule you a time to come in. They'll draw your blood and then make your drops. And he said, give them a try and let me know how it goes. That, I'll be honest, that was just such a positive thing. Like, I just left that appointment feeling so much hope, because boy, I have just had such a time with these eyes lately. And I mean, it's just not been fun, and I just felt like I didn't really have a lot of options. And so it's like, oh wow, here is something that really could help me. So the next day, that pharmacy called me and gave me a little bit of information, about cost and just kind of how the whole procedure goes. And they said, we stay, pretty booked up. I guess they have a lot of patients. And so they wanted to go ahead and schedule me for an appointment so I could get in as quickly as possible. But honestly, it was not until about maybe 2 weeks later. But I took the first available. And so I went in, a couple of weeks later. My appointment was like at 9:30 in the morning. And I met with the pharmacist. And then they drew my blood. And then they said, okay, well, we'll call you when they're ready. And you can come and either pick them up, this afternoon. Or if you need to, you can come back tomorrow. Let's see. I think they were ready around 12:30. I ended up getting them probably around 2 o'clock. Got home, close to 3, because it's in our area where we live, but it's not in the city where we live. It's another suburb city, and it's about a, I don't know, 40-minute drive. So I got the drops home and went ahead and put a dose in. You just do 1 drop in each eye. You do them 4 times a day. And so I did them at like 3 o'clock. I did them at 6 o'clock, and then I did them again at 9 o'clock. I couldn't do, 4 times really, because I had missed a big part of the day already. But I'm telling you, at the time, my left eye, and it's been doing this thing for several years, and I really don't know what it is, but where it'll just get like really angry and inflamed. But also it's like the whole eye socket around my eye, and even it kind of feels like maybe even back behind my eye. And all that had gotten extremely flared up the day before. And by that night, when I went to bed, that left eye felt so much better. And then when I woke up the next morning, it felt really, really good. It started off really well. So let me just give you a little bit of other information in case you're curious about these drops. The doctor had written the prescription for 30% for me. So what that means is they take your blood, they spin it in a centrifuge, they pull out the serum part of the blood, which is yellow, and then they combine it with like a sterile saline. So in my case, 30% of that drop mixture is my serum. But you can go up to 40, 50, 60. The pharmacist said in theory you could go up to 100%, where you'd have 100% of serum be the drop. But, obviously they'd like to kind of start you off a little lower, and then they can work their way up if they need to. And the drops have to be either frozen or refrigerated. So when I picked them up, I had actually taken like a little, one of those kind of like soft coolers, like a kind of like you'd have as almost like an insulated lunch bag, but it was a little bit bigger than that. And so And we can put some pictures on here to show you what it actually looks like. But they came in a box, and it's a bunch of tiny little bottles, and it's a 3-month supply. And they all have a little label on them that has my name and I think my birth date and, the pharmacy name and all of that. So, I put the box of them in the freezer. Like I put them in a big Ziploc bag, sealed it up, and put that in the freezer. And then, you just take one little bottle, one little vial out at a time. And that stays in the refrigerator for 3 days. So the amount that's in that one little bottle is enough for 3 days. And it does require a good bit of kind of, you got to really stay on top of it and make sure you're tracking things. So like when I start a new bottle, I just jot it on the calendar. Like I have a paper calendar. I'm very old school, and I'll just put like drops day 1 on there. And then I know they're good for that day, the next day, and the next. And then usually I'm using up pretty much every bit of it, But even if you have any extra left, you just toss it and start fresh. And so what I'll usually do is, like, let's just say I'm using the last bit for my last dose on that last day. So then before I would go to bed, I take a frozen bottle of drops out and put it in a Ziploc bag and put it in the refrigerator to thaw overnight. And they really don't take long to thaw. There have been times when I have forgotten to do that already, and I've just been doing them for probably about 2.5 or 3 weeks now. But it's fine. You can just if you need to get a fresh bottle out, like in the morning, on that first day, I just will like get one out, put it on a little clean plate, let it sit there for about, I don't know, 20 minutes, 30 minutes, and then it's turned to liquid and ready to go. So anyway, now traveling, I had just done an episode about going to Texas to see a biologic dentist about having mercury amalgam filling removed. And so I had to travel with my drops, and that was the first time that I've ever had to do that. My husband and I ordered something from Amazon that it wasn't specifically for eye drops, but it was actually for like, I guess insulin for, that diabetics might need to have cold. It was a little kind of travel case where it had this like kind of frozen pack that had an insert area, kind of like a carved out, grooved out area, and where you would put the insulin or an insulin pen in there. And so I just put my little bottles of drops, and I just really had 2 because I just had one that I was currently using and then one that was going to be, fresh. It did okay. I will say that I goofed up a little bit. Like our hotel room had a refrigerator that had one of those small freezer compartments in it, and I just left that whole thing in the regular fridge that night after we had gotten in. I should have gone ahead and pulled that extra freezer part and put it in that little freezer just to make sure it was extra cold. And so with all the travel going to the dentist, which was about an hour away from our hotel, by that afternoon I kind of felt like the drops had probably gone a little bit above the temperature where they needed to be. That meant that it didn't have drops for the next day, which was the travel home. And I think my eyes got a little upset at me. I mean, I was still using, just regular, the regular drops that I use to hydrate. Anyway, I'll get better at it, right? It's sometimes kind of a learning curve. And it's not like you really want to waste them because they are pretty expensive. But anyway, it is a process. So anyway, I'm super excited about this. the next go round, which will be in about 2 months, when I get, my next batch, I may go up a percentage, like say to 40%, and see if that'll help me a little bit more. Overall, I think they definitely are helping my eyes, and the pharmacist did say that it takes some time. It just can kind of take some time for your eyes to do some healing. And goodness, mine certainly, they certainly need some healing. But anyway, I just wanted to let y'all know about that, and it's a new thing, and it's it's exciting for me, and it just might be an option for you if your doctor mentions it. I just like the fact that it's my own blood, right? It's not just some chemical mixture of something, but it's kind of like your own body healing your own body, which I think is really cool. So I will say this, though, if you're dealing with dry eye, there are a lot of resources out there. Just do as much research as you can. If you're just having to get into the world of drops, where you are having to do the re-wetting drops, make sure that you don't use something that has a preservative in it, because those over time can really irritate your eyes. So try to always look for something that has, like maybe a disappearing preservative, where the moment that the drop hits the air, the preservative kind of breaks down and dissolves, or just no preservatives at all. Like my normal re-wetting drops that I use, and that's aside from those serum drops, but they are just little individual vials. It's like kind of just a one use type thing, where it's like maybe 4 of them that are kind of all stuck together, and I just peel off one and put my drops in, and throw that vial away. But anyway, also I wanted to mention that, and this is probably a whole nother YouTube episode, along the lines of me, getting to be middle-aged and with the menopause and all of that. It could be, and I pray that it's not, but it could be that I may be coming down with Sjogren's syndrome. Like maybe I had some side effects from that medicine all those years ago, but Sjogren's is a condition that can come alongside with a lot of different other autoimmune diseases. My mother had it along with rheumatoid arthritis, and it can go hand in hand with lupus and I think maybe multiple sclerosis. Anyway, a lot of times, with Sjogren's, one of the main symptoms is dry eyes and dry mouth. It really can be complicated and affect way more than that. And I'm just now kind of diving in and learning a lot about it. But anyway, something to think about. All right, well, thank you so much for watching. And if you would, please like and subscribe. All right, see you later. Bye.